Dentistry is the profession or science of dealing with the prevention and treatment of diseases and malformations of the teeth, gums, and oral cavity, and the removal, correction, and replacement of decayed, damaged, or lost parts. There are many different aspects to dentistry. To start things off, let's go back to the beginning. The first signs of early dentistry date back to ancient Egypt. Archaeologists uncovered skulls from 2750 to 2900 BC that had small holes in the jaw near the tooth roots. These holes were most likely drilled to drain abscesses. The first occupational dentist was believed to be Hesi-Ra. Hesi-Ra was a high-ranking Egyptian official and priest. In 600 BC, in what is now modern-day Lebanon, the first documented tooth replacement procedure was performed. An extracted tooth was replaced with an animal tooth and attached using a cord. In 166 to 2001 AD, Etruscans started using dental prosthetics. These include the use of golden crowns and dental bridge work. Aristotle, a renowned Greek philosopher, had also mentioned fixing teeth using various remedies and instruments. He even mentioned fixing teeth and jaws with wire.
Since then, advances in dentistry have made procedures much more simple and painless. Dentists now use special dental cements that harden almost instantly when exposed to ultraviolet light. This special cement is used in many procedures, including filling. Technologies such as the intraoral camera and digital x-rays allow dentists to show their patients exactly what is wrong with their teeth and what procedures are needed to fix the problem. Dentists can show digital x-rays on the monitor immediately after they are taken. There is no longer a need to develop the x-rays. They can also display a live view or pictures of a patient's teeth onto a monitor by using an intraoral camera.
Since I'm trained as a general dentist, I do all different procedures. I do root canals, I do fillings, restorative dentistry. I work on children. I do oral surgery. I take out teeth. I do crown and bridge work. So I do just about everything I possibly can with dentistry.
The number one most common procedure in dentistry is an exam. Some of the instruments used in this procedure are dental mirrors, dental explorers, and periodontal probes. Dental mirrors allow dentists to gain a complete view of your teeth. Mirrors are easily the least intimidating instrument on the dental tray. They simply consist of a thin metal handle with a small rounded mirror at the end. Dental explorers are small metal tools with a pointed hook on each end. They are used to explore soft spots in the teeth that may indicate tooth decay or cavities. During an exam, dentists also use a periodontal probe. This tool is used to accurately measure gaps between your teeth and roots. This helps dentists determine if any bone loss has occurred. Some other common procedures in dentistry are root canals, fillings, crowns, and extractions. A root canal is when a hole is drilled through a tooth to remove infected pulp. A permanent substance is then used to fill the hole. A crown or cap is a metal or porcelain piece put over damaged or broken teeth. This covers the whole visible tooth above the gum line. Crowns also improve the appearance of the tooth. An extraction is when a dentist removes a whole tooth from its socket in the jawbone. Wisdom teeth sometimes require extraction, and patients who have to get braces may have to have extractions. Braces are the work of an orthodontist. It is a device designed to straighten teeth, correct underbites and overbites, and correctly align teeth by applying a constant and steady pressure. Other devices such as forceps springs are used in extreme cases of misalignment.
Tooth cavities are very common. 60 to 90% of children have had cavities filled and nearly 100% of adults. 15 to 20% of middle-aged adults, 35 through 44, have had periodontal disease. This is a serious infection of the gum line and can damage the jawbone if left untreated. You can avoid cavities and infection by practicing basic hygiene. To have a hygienic mouth means to have teeth that are clean and don't have debris, and have gums that are pink, healthy, and don't hurt. Bad breath isn't a problem when your mouth is hygienic. To achieve a hygienic mouth, you should brush at least twice a day and floss at least once a day. You should also be eating a balanced diet and limit snacks in between meals. To help clean your mouth, use products with fluoride, such as the obvious toothpaste. Most importantly, listen to the advice and instructions of your dentist. To properly and thoroughly brush your teeth, you can follow these steps. Before you do anything, make sure your brush is at a 40-degree angle. Then you can start by gently sweeping the brush against your gum line. and gently brush the outside and inside of each tooth with short back and forth strokes. Finally, you should brush your tongue. This helps to remove bacteria and eliminate bad breath. Another important part of keeping your teeth nice and clean is to floss. To properly floss, you should start with about 18 inches of dental floss. You need a couple inches at the end of the strand of floss to hold on to it. Next, start gently following the edges of your teeth. Finally, clean beneath your gum line. Be sure to avoid snapping the floss against the gums. There are many different jobs in the field of dentistry. There are general dentists who handle the most common dental procedures, orthodontists who specialize in aligning the teeth and jaw with braces, periodontists who treat gum, endodontists who fix the roots of teeth, pediatric dentists who work on children, prosthodontists who focus on creating artificial teeth, and oral surgeons.
Well, of course, you have to go through the elementary school and high school, and then after that, 4 years of college generally. That's what is required now. And then after 4 years of college, do 4 years of dental school. Dental school is always 4 years to become a general dentist. If you want to become a specialist, then you go on either 2 or as many as 5 years additional if you want to become an oral surgeon. But for a general dentist, it's typically 4 years of college and 4 years of dental school.
I actually went through 3 years of undergrad, and it's required for you to take general biology in the labs, a year of that, general chemistry and labs, organic chemistry, and general physics. So normally it takes 4 years of undergraduate work and 4 years of dental school. Probably being your own boss. My husband and I have been dentists for 29 years here in Fairfield, and we originally started with 2 practices. We worked down in Keosauqua, Iowa, and also up here, but we have stayed up here in Fairfield, and I've just been able to run our own business. It's taught us a lot about being a business person, and also, we're helping the general public. Yes, we've been called out at 2 a.m. with, toothaches, or on the weekends, if somebody's hit in the mouth, we're called in. So it's you never know. Well, if you're interested in dentistry, I would highly encourage you to at least go into the dental office and follow a dentist to see, what they do all day, and how things go in the office, and if that is something that you would like to do. You're working with the general public all day, and you have to work on your people skills, and also be professional. And also, if you like the sciences, I think I highly recommend dentistry as a profession.
To become a dentist, you need at least a bachelor's degree. After that, a dental degree program has to be completed. Finally, you would need a doctorate degree in dentistry. Dentists in all states are required to have a dental license. The average mean salary for a dentist in 2014 was about $150,000. Dentistry can be a very complicated and difficult profession, but it can also be very rewarding.